Congenital heart disease. We're gonna learn about congenital heart disease. First thing we're gonna learn is right to left shunt. When we say right to left shunt, there is deoxygenated O2 are pumped in the blood. And these things we call it cyanotic because deoxygenated O2 give the color of blue or purple, which is mean cyanotic. The another name for right to left shunt is cyanotic congenital heart disease. We have 5 things to learn in right to left shunt, but we can first start with Tetralogy of Fallot. Tetralogy of Fallot. Let's cut this word. What is the meaning of tetra? Tetra, it's mean 4. And right, in Tetralogy of Fallot we have 4 anomalies. First one is pulmonary stenosis. Like here. This is, we call it pulmonary stenosis. The second one is right ventricular hypertrophy. Like here in the picture, we see that the right ventricular is increasing in size. So we call it right ventricular hypertrophy. When we have right ventricular hypertrophy, it creates pressure in the right side. So it will make the blood move from the high pressure to the low pressure. So it's gonna move from the right to the left. So the blood gonna move like that, from right to left. And right ventricular hypertrophy, when we see it in chest X-ray, it gives us a pot shape. Like this in the picture, pot shape. The third anomaly is VSD, ventricular septal defect. Here is ventricular septal defect. It means that there is a defect in septal between the right ventricular and the left ventricular. And the third one is overriding aorta. It means that the aorta is sitting in both ventricle between the right and the left. Overriding aorta. This means that the aorta is sitting between the two ventricles. So, let's repeat it again. Tetralogy of Fallot. Guys, remember, when we say Tetralogy of Fallot, when we hear tetra, remember there is 4 anomalies. 4 things. You need to recall 4 things. First one, pulmonary stenosis. Second one, right ventricular hypertrophy, and that's things that make the blood move from right to left. Also in VSD, ventricular septal defect. And we also have overriding aorta. We should remember, in right ventricular hypertrophy, it will give us a shape, we call it pot shaped in chest X-ray. Okay guys? Okay. What is the cause? The cause is thought to be due to genetic factor, environmental factor, and maybe it's associated with chromosome 22 deletion. Let's go to the clinical presentation. We say it's a right to left shunt disease. So of course the baby will come in cyanosis. His lips, finger is turned to blue color. But we see the degree of cyanosis, it's depend on the degree of right outflow obstruction. Here, it's depend on pulmonary stenosis. When we have a less degree of pulmonary stenosis or less degree of right outflow obstruction, we will have more natural color. But when we have a more degree in right outflow obstruction, there will be more cyanosis. So let's repeat it. When we have a less degree of pulmonary stenosis or right outflow obstruction, we will have more natural human color, like less cyanosis. But when we have more degree of obstruction, when we will have a more cyanosis. Okay, because it makes more sense, because the blood is not going to the pulmonary, it will not get oxygenated, it will stay in deoxygenated form. We also have a tet spells. That means on exertion we need more, there will be increase in oxygen demand, and that will mean pump more blood. So it will skip the lung, it will bypass the lung. So it will make a sudden decrease in O2 saturation and will create cyanosis. So the baby, when they have a tet spell, they may be squatting, or we do a position, it's called knee chest position. It will improve the cyanosis. These two positions will improve the cyanosis. Like this. This is knee chest position. Placement of the patient in a knee chest position, like squatting during a cyanotic spell, increase systemic vascular resistance. Also increase pulmonary blood flow and improve symptom and cyanosis. Increase systematic vascular resistance because it connects the femoral artery, which will make more systemic resistance. How we diagnose it? First thing, by chest X-ray. We say we will saw a pot shape. Also, we have echocardiogram. How do we treat it? Tetralogy of Fallot by surgical repair. Surgical repair, we have to do two things. We have to treat or repair the VST and the pulmonary stenosis. VST by close the septum and pulmonary stenosis by enlarge the obstruction outflow.